Grisilda? Yeah, please go.
A very good morning, everyone. On this beautiful day, I'm going to present my presentation, an unusual pencil tip injury. As we know, intraorbital foreign bodies can have varied presentation. A simple-looking injury can lead to severe consequences. Here is presented a case of simple-looking pencil tip injury leading to intracerebral granuloma formation. A 5-year-old girl presented with swelling of the right upper lid a month after pencil tip injury. She had received conservative management for the past 1 month after the initial injury. Her chief complaints were redness of the and swelling of the right upper lid, which was associated with headache. On inspection, the right upper lid swelling was seen, leading to ptosis. No visible pulsation of foreign bodies seen. No change on bending over or on Valsalva maneuver. On palpation, a firm mass is felt, which is non-tender, with overlying skin temperature slightly raised, extending from the middle canthal area to the junction of the middle 2/3 and lateral 1/3 upper lid. It is non-reducible, non-compressible, no pulsations were felt. The rest of the ocular examinations were unremarkable. On CT orbit, head and orbit, it showed two hyperdense shadows, one in the anterior orbit and the one in the frontal lobe. The latter was reported as a piece of fractured bone and the one in the orbit as pencil tip. Patient was treated conservatively on oral steroid and oral anti-epileptic as per consultation with the neurosurgeon, and patient responded well to treatment. On subsequent follow-up, which is 10 months later, there was spontaneous extrusion of the pencil tip from the anterior orbit. Extruded two small wooden bits were noted, which are less than 1 centimeter size. Few months later, 9 months later, patient again presented with the fullness of the right upper lid. After due confirmation that graphite in pencil is not magnetic, MRI was done and it showed blooming effect. Due neurosurgical opinion was again taken and conservative management was again advised. 2 years later, patient came back with similar complaints of tender swelling with signs of inflammation of the right upper lid. Exploration and excision of the granulation tissue was done. Intraoperatively, blackish soot-like material within the granuloma was found. Diagnosis of inflammatory granulation tissue was made on histopath examination. Patient was followed up at regular intervals. On subsequent follow-up months later, parents noted that the patient has alarming new symptoms of drowsiness and decreased activity and interaction among peers along with behavioral changes. This prompted for repeat imaging. On CT, head and orbit showed both a granuloma, both on CECT and non-contrast, in the frontal lobe. Hence, with neurosurgical intervention was done, the frontal lobe granuloma required neurosurgical intervention and anterior craniotomy with deep exploration was done. The granuloma, which was again tinged with the same black soot-like material as in the previous orbit granuloma, was excised, and along with it, the offending pencil tip was found. There were no major postoperative sequelae and patient recovered well. In conclusion, this case highlights the fact that some simple-looking injuries can actually be life-threatening. Also, graphite in pencil is paramagnetic due to the silica which is in the clay component, which is added to harden the otherwise brittle and fragile graphite, and this can interfere with MRI by creating the blooming effects. Thus, pencil tip injury can cause chronic granuloma formation just like wood and should be removed as far as is possible. Thank you.
Very nice case. Thank you very much.
Thank you, sir.
Any comments?
That tip in the frontal lobe was first reported as a fractured bone. It was not reported as a pencil lid. So hence, as per the neurosurgical advice, we said that not to interfere with it. The patient is not having any symptoms as such. So if it is a fractured bone, it will not be creating any symptoms and all. So neurosurgery had advised not to touch it. So it was treated conservatively initially.
The first image was a CT scan. So obviously anything that is hyperdense is considered as fractured bone, and she had a defect in the roof as well. So this was a kind of a severe injury with the pencil which penetrated the roof and deposited the tip in the brain, which was possibly missed because initially CT was done, and later on MRI, when there was already a granuloma formation, blooming artifact can be there with a pencil tip as well because it is paramagnetic, and even in granuloma you see the same.
Yes,
so it was a parallel kind of overlapping situation. Finally, the management was well done anyway. Thank you so much.
Any more questions? It's okay. Thank you for your time.
Any more questions? Comments? First time you saw the case. Very good case.
Thank you.
Very educated.